Hi, I'm Diana Yasani.
And I'm Dr. Renelle Brew.
We're founders of Parasol Health Consulting and workforce development trainers. We're really excited to be by Jessica Schmall, a mental health consultant and founder of Wiser Ground LLC, to talk a little bit about navigating turbulent work environments in healthcare and public health. We are challenged right now with workforce sustainment and development in public health and healthcare because we're seeing at conferences and with our clients right now a lot of stress. And Brene Brown's new book, Ground, was kind of an inspiration for this conversation. So I'm going to dive right in. Jessica, I've got my first question for you.
Great.
Um, in Strong Ground, it got us thinking about the workforce we talk to most often and the challenges they're facing. The book introduces an idea of turbulent work environments as spaces where uncertainty, like the foundation of anxiety, risk, and emotional exposure collide. In healthcare and public health, this feels really timely, especially with staff burnout and challenges to perceptions about their work on the rise. How do you define this turbulence, and why does Brown's concept feel so timely to you?
Yeah, hi, thanks for having me. Turbulence in these fields is the perfect storm of external pressures like political volatility, funding gaps, and public scrutiny, and internal struggles like moral injury, emotional overload, burnout, and blurred boundaries. Brene captures this in Strong Ground as a landscape where people feel untethered or constantly bracing for the next crisis. What makes this timely is the sheer scale of exhaustion. We're seeing professionals in public health and healthcare leave because their wells have run completely dry. Brown's core message is that vulnerability is not weakness, but the bedrock of courage, and it helps us reframe this. There's no vulnerability without risk. Turbulence isn't just a problem to fix, it's an invitation to build resilience through connection, not isolation.
Thank you, Jessica. I have a three-part question for you. So many employees are feeling trapped between their mission to serve and the toll of turbulence and uncertainty. Do you have any ideas to help them cope without quitting and maybe some practical steps that staff can take to protect their well-being? And I guess at the end of the day, is quitting really the answer sometimes?
Well, resilience starts with reckoning with emotion or naming what we feel, like overwhelm or grief, instead of numbing or ignoring it. When we are in a space of resilience, we can withstand difficult conditions or situations and be more able to work through the conflicts and challenges we may be facing, intra or interpersonally. This may mean the difference between deciding to leave a role or system and allowing us the gift, albeit the necessity, of true exchanges of ideas, feelings, and solutions that are forward moving. For your audience, this means, for example, practicing micro moments of self-compassion. When stress hits, pause and say, "This is really hard right now," or "This is a moment of suffering." Instead of pushing through, it's not selfish, it's sustainable. Self-compassion also unlocks our ability to show compassion to others, which furthers the connection within a team, system, or organization. Setting boundaries as an act of courage is another. Brown calls boundaries the key to self-love. Additionally, they are kind to others because they are transparent and keep us out of resentment due to boundaries being knowingly, unknown, or unknowingly crossed. For example, managing expectations around after hours emails or protecting lunch and other breaks can move beyond logistical and move into honoring one's values and worth. It is also critical for each of us to identify our internal capacity for work, stress, and energy, and so on, and honor it without judgment to ensure we don't push too far and unwittingly violate our own boundaries. Seeking story stewardship is another. Sharing experiences with trusted colleagues to combat shame and find the universality in our experiences, which normalizes the pain and promotes shame and sorry, promotes connection. As Brown says, shame thrives in silence. These steps aren't about avoiding turbulence. Often we don't have that luxury, but they are more about learning to navigate it without drowning.
Oh, that's a lot. Thank you. Um, so we talk with staff and employees, but we also talk with leaders, and we understand that you work with executives and leadership all the time at organizations. One of the things that we've seen is that leaders are often blamed for turbulence or expected to have all of the answers. So, what's your approach when you're working through, group work or with individuals to guide leaders through the chaos? And how can organizations better support their leaders?
Yes, great question. Well, Brene Brown emphasizes that leaders must model vulnerability to create psychological safety and promote creative work. In turbulence, the bravest thing a leader can do is say, I don't know, or I'm struggling too. This disarms shame, blame, and invites collaboration. But organizations often fail leaders by not providing them with the tools to foster this. Trauma-informed strategies can include training leaders in empathy and action, which is teaching them to listen without fixing and acknowledge emotions like, this is tough, I'm here with you. Building resilience reservoirs, encouraging leaders to take real time off and model self care. Burned out leaders can't pour into others. Exhausted leaders who themselves are burned out frequently struggle with tending to their teams, causing communication to break down and connection and trust to be lost. Or redefining strength. As Brown cites, courage is contagious. Leaders who embrace their humanity empower teams to do the same, reducing turnover. It is important to remember courage is not the absence of fear. It's choosing growth and change over comfort.
Thank you, Jessica. Some really great strategies there to consider. From an organizational lens, what trauma-informed practices should these disciplines adopt to align with healthier practices? And furthermore, how can they transform turbulence from a liability into a catalyst for growth?
Sure. Well, Brown's work again teaches that organizations must move from scarcity, which is fear or of loss or there not being, enough, to abundance or trust in collective strength. Trauma-informed practices include creating connection anchors, is her term. Regular structured check-ins where staff share wins and challenges without judgment. This builds the belonging Brene cites as critical for resilience. And she notes in other work that belonging is not the same as fitting in, which requires us to morph and change to match or resemble the others in the room, foregoing authenticity and emotional honesty. Reforming hustle culture is another. Audit workloads and a limit productivity theater. Reward sustainability, not just sacrifice, and combat the belief that being busy is not a badge of honor. And additionally, investing in vulnerability infrastructure. This means counseling access, peer support groups, and leadership training that destigmatizes mental health, which can invariably will show up in the workplace. When organizations do this, turbulence becomes a shared challenge to solve, not a burden to bear alone. Teams stay because they feel valued, not just needed or used.
That's amazing. I really hope that organizations do invest like that.
Uh,
So we're just going to wrap up with one more question for you,
uh,
and that's what's the hopeful takeaway that you can offer for these fields, which are kind of on the brink right now? Like, how can employees and organizations reimagine their relationship with turbulence?
yeah, good question again. Brown's core message is that turbulence is not the end of the story. In group counseling, we call this phase of working together storming and norming. It is painful, but it is temporary. In Strong Ground, she reminds us that the most beautiful, innovative work happens in the messy middle, when we stop fighting the storm and learn to dance in the rain. For employees, this means recognizing that their worth isn't tied to endless endurance, performance, or productivity. For organizations, it's a call to build systems where people truly matter more than metrics. The hope that by embracing vulnerability and strength, healthcare and public health can become beacons of what Brown calls wholehearted culture, where turbulence is met with resilience and no one has to walk alone.
Well, I just want to thank you for your time today. I know this is short, but I know the three of us were kind of inspired by this latest work by Brene Brown, and it really fits the businesses that we support other organizations with. So thank you so much for your time. We'll have information about our organizations attached to this video. Thank you so much to my partner, Dr. Renelle Brew, and Jessica Schmal from Wiser Ground.
Good to be with you.